Hi, I'm Dr. William Wierda from the MD Anderson Cancer Center in Houston, Texas. We recently virtually attended the ASH 2020 meeting, and one of the abstracts that I presented was an abstract on the TRANSCEND CLL study. The TRANSCEND CLL study is a phase 1/2 clinical trial of CAR T-cell, CD19 CAR T-cell therapy for patients with chronic lymphocytic leukemia. Prior presentations for this study have been made, particularly by Tanya Siddiqui with JCAR17, which is the CAR T-cell therapy as monotherapy for relapsed and refractory CLL. The presentation that I made at this recent ASH was a combination of JCAR17 plus ibrutinib. And this combination was based on preclinical data that demonstrated improvements in immune function and quality of T cells used to make JCAR17 in patients who had been on ibrutinib. This is data that had been generated, preclinical data that had been generated by the UPenn group, and also clinical data for cohorts of patients that had been treated with CAR T-cell therapy, monotherapy versus in combination with ibrutinib from the UPenn group as well as the University of Washington group. And those comparisons in terms of retrospective comparisons in terms of those two populations suggested that there might be a better tolerability profile and improved toxicity profile when CAR T cell is combined with BTK inhibitor, particularly ibrutinib. So the TRANSCEND study has two cohorts in terms of monotherapy versus JCAR17 plus the ibrutinib. There were 19 patients treated in the combination cohort, and there had been 23 patients reported at ASH 2020 by Tanya in a monotherapy cohort. I think the importance from the data that was presented with regard to the combination cohort was that there was certainly safety associated with this combination. Patients who were enrolled in the combination cohort started ibrutinib at apheresis and continued it through JCAR17 administration, as well as 90 days following administration of the CAR T. In terms of the rate of CRS, was a 5% patients had grade 3 or higher CRS in the combination cohort, and there were 22% who had grade 3 or higher neurotoxicity associated with JCAR17 treatment. There were no untoward or unexpected toxicities associated with the combination. And the complete remission rate and undetectable MRD rates were notably significant for a patient population with relapsed and refractory disease. So the complete remission rate was about 60%, undetectable MRD rate was about 70 to 80%. In this cohort of patients. It's very difficult to make comparisons in terms of efficacy and toxicity between these two cohorts of monotherapy versus combination therapy on the TRANSCEND study because it's not a randomized comparison. Nevertheless, I think the results show that the combination is safe, it's well tolerated, and the study continues to enroll patients for phase 2 in the monotherapy arm, and there is a phase 1b expansion for the combination patients. So we continue to enroll patients on this study in both monotherapy and combination strategies with the goal of collecting more data around activity, efficacy, and safety.